Hi, my name's Alice. I'm one of the midwife sonographers here in Powys. Just wanted to come on and chat to you a little bit about the services we provide within our day assessment units. So our day assessment units are based in Landrindod and in Newtown. We provide scan appointments during your pregnancy. These include your dating scan, your anomaly scan, and any growth scans that you need. We can also provide presentation scans if your community midwife is unsure of which way your baby's lying later on in your pregnancy. We also provide monitoring if you're concerned about your baby's movements. So it's really important that if you're concerned at all at any point in your pregnancy about the movements, you contact your community midwife. If you're over 28 weeks, you're able to come into our day assessment units and have electronic fetal monitoring. And it's really important. A moving baby is a happy baby. So if you're concerned about the movements at all, it's always best to get checked out. Obviously, you're aware that partners aren't able to attend during their appointments within the birth centres or within our hospitals. This includes any scan appointments you may have, so your dating scan, your anomaly scan, or any growth scans. We understand this is causing a lot of anxiety for women, and also some concerns have been raised by our women and their partners around the being able to provide a gender at the anomaly scan. Obviously, the anomaly scan is to look for any abnormal fetal structures, so we check the baby's heart, the kidneys, the stomach, the spine, making sure that there's 2 hands, 2 feet, checking the structures in the brain to make sure baby's developing normally. A perk of having this scan is that if the baby is cooperating, we will be able to tell you the gender. However, during the COVID-19 outbreak, we are trying to reduce our scan times because of the close contact. So if we won't be able to extend our scan slots to find out the gender for you. Also, in line with Antenatal Screening Wales guidance, we're not able to write down the gender on a piece of paper for you either. We have to verbally give you the gender of your baby, but also to remind you that this isn't 100% accurate. We can be wrong. So just to bear that in mind if you are asking to find out the gender at your anomaly scan. Unfortunately as well, we're not able to allow FaceTiming or videoing of scans. This again is national guidance that's come out from the British Medical Ultrasound Society and the Society of Radiographers. When you come for your scan, it is a detailed scan at every appointment, even at dating and at growth scans, and we need to ensure that we reduce the chance of the sonographer getting distracted, which could possibly mean that we miss something. So unfortunately, videoing isn't allowed. However, we do provide scan photos free of charge, and during the COVID outbreak, we're happy to provide you with extra scan pictures if you wish. I'm just going to show you now a virtual tour of our day assessment unit, so that you have a bit of an understanding of where you're coming to, what the environment will look like when you get here. It is slightly different in Newtown, but the principles are the same. You'll be scanned in one room and then taken to another for your blood pressure, urine checks, blood samples as well. We also provide scanning services in Brecon and Ystrad. Ystrad, we've increased our scan days to 1 day a week instead of alternate weeks to reduce the likelihood of our women in Ystrad having to travel up to Brecon for their scans. And Brecon, we are scanning 2 days a week. These services are monitored weekly. And changes can happen. If they do happen, we will be communicating those changes out to the women attending for appointments. We would ask you to keep an eye on your phone. Any phone calls from withheld numbers or 0330 numbers could be the day assessment unit trying to get hold of you, just to check that your healthy, nobody in your family is unwell, and you're able to attend for your scan appointment. Okay, looking forward to seeing you soon. Bye.